Hey everyone, how's it going? My name is Jay and welcome back to Aris Think Tank. Today we're going to be talking about the difference between bipolar 1 and 2 and some of the social stigma that comes around bipolar when someone gets diagnosed with it. So stick around and let's find out here at Aris Think Tank. Alright, so let's start here with bipolar 1 and 2 because it's typically, in my opinion, one of the most misunderstood diagnoses out there socially. A lot of people don't really know what bipolar is. When most people hear bipolar, they think, oh, a crazy person at a bus stop yelling at people in downtown Houston, which they're called unsheltered individuals, and a lot of people do struggle with mental health. So as a mental health professional, I'm trying to change the language on my own through videos. I know there's other people out there doing the same thing, but one thing to really focus on bipolar 1 versus bipolar 2, let's start with bipolar 1. So with bipolar, there's going to be highs and lows. So someone's going to be feeling great, like a roller coaster. Oh, we're up there, we're getting manic, and then kind of like the Disneyland rides. There's the lows. How long the lows staying for kind of depends on individual to individual, but with bipolar 1, it's defined as having a manic episode that lasts at least 7 days. And this can typically involve, after 7 days of no sleep or manic episodes or low amounts of sleep, the lack of sleep and the manic highs can lead to individuals going to something called psychosis. And the psychosis can also lead to individuals becoming hospitalized because they might be deemed as dangerous, mentally unsound. Typically, I think it's the same all around the United States, but there's typically if you commit yourself to a mental institution or a mental hospital, you might be on a 3-day hold. Some people who are held in a hospital against their will is not the right terminology, but involuntary is a better terminology. This might be because of law enforcement, loved ones, society, depends, but yeah, there's different reasons that people get hospitalized for this. And y'all, just so y'all know, here at Aris Think Tank, we kind of build the plane as we fly with our videos because I like to really give y'all the best information I can. I know some of y'all are studying, some of y'all are just interested in mental health, some of y'all might be thinking about going into mental health, so we really do try to give the best accurate information and to keep the haters out of my comments. So I did use some terminology that some people might not be familiar with yet. So let's start with psychosis. It's defined as psychosis, a mental health symptom, not a specific illness, characterized by a loss of contact with reality, where an individual struggles to distinguish what is real from what is not real. So some bipolar individuals, they might be awake for, and this is the difference we'll get into later. Some individuals might be, when they're hitting that manic high, they might feel like they don't need to sleep for 4 days. It might be up to 7 days, and that's where it starts to distinguish. So people are starting to lose contact with reality because they're not sleeping anymore. They're hyper-focused on something. They're feeling great. And like I said, there's always the lows on the roller coasters. So that is psychosis. So let's talk about the difference here. So bipolar 2 is a lot more mild. Typically, these individuals haven't been hospitalized for it. Possibly, it's let's see here. They typically have hypomania, which can last up to 4 days. It's a revved up version of yourself, but often followed by a much more crashing, mandatory major depressive episode. So remember, if you're awake for multiple days at a time, don't do that, guys. I know this is a disorder. Some people think it's cool to be awake for multiple times. I used to be there when I was younger. I'm 31 now. But your body needs sleep. Your heart needs to rest. Your brain needs to rest too. So some of these individuals might get little sleep to no sleep, so under 4 or 5 hours, something like that, and they keep going for days at a time. This does eventually affect how you think, and it can exacerbate your symptoms. And eventually someone can go from bipolar 1 to bipolar 2, or bipolar 2 to bipolar 1, depending on what's going on. A little bit more on the differences here. Bipolar 1 is defined as a severe manic episode, often requiring hospitalization, and major depressive episodes, while bipolar 2 involves milder hypomanic episodes and major depressive episodes. So, like I've said, really the biggest difference between the two, bipolar 1, you're going to be manic for at least 7 days. Bipolar 2, going to be a little bit hypomanic, but not full manic. You're going to be probably feeling your symptoms about 4 days on the manic highs, but you're going to be feeling those lows too. The reason that, in my opinion, why this disorder is so socially stigmatized is because it's really misunderstood. When someone's diagnosed with bipolar 1 or 2, they usually have other symptoms or diagnoses as well. It could be anxiety, depression, PTSD, and a mixture of other things. And another thing is finding the correct cocktail of pills and therapy for these individuals can be really hard too, because let's be honest, if you don't have the proper resources, they are going to send you to a mental institute, possibly if you're lucky, if you're safe, for a few days, get some meals, maybe get enough medication for a month or two or 90 days. And these individuals might not go back to get a refill or might not have the resources to get more medicine. So it's just society slowly fixing itself. But thankfully there are mental health professionals out there and nonprofits that do help individuals get these medications. Look into your local mental health authority. For example, Harris County in Houston, Texas, one of the fourth largest city in the United States. The local mental health authority for Houston, Texas is the Harris Center. So the Harris Center can help people find medications, therapies, IDD services, different things like that. So look up your local mental health authority. It's typically broken up by counties. I've been blessed enough to work with my local mental health authority and Harris Center as well, and a lot of different size scales. So drop your comments down below. Let's see what you've heard about bipolar. Usually what I hear is that, oh, that person's bipolar, they're crazy. And that's really the biggest thing we need to fight on mental health.